Hi, y'all. Welcome to Griffon Show. Great to have you with us as we rock and roll. Terrific Tuesday. Headed to Brandon's favorite day, which is always on a Friday. We'll go from my favorite day to his favorite day. We start on my day and we end on his. Anyway, appreciate you being part of the program. 844-766-6607. Hickson has a hotline. Yes, a lot of stuff happening in the legislature. I am getting ripped on about Bill Cassidy. And by the way, I agree with him. I think Bill, goes on Jimmy Kimmel, and Bill wants to give everybody HealthCare, and you don't give anything to anybody. Everybody ought to go ahead and pay for their own. It just needs to be competitive, where people can go out and be the best they can be. Government's too much in control of HealthCare, and so anyway, I'm just getting ripped. And I'm like, people are being nice about it. They're saying, well, your buddy is no conservative, and he's not. He's voting for the omnibus bill again, and I understand that. He's just not coming across as a real conservative. But I do have one that is coming across a real conservative. That's John Kennedy, and everybody's really happy with John's doing. John's kind of becoming a rock star pretty quick, Brandon, because he's in there. He's asking its question just like he did on our program. He's not scared to fire back. I wish John had quit saying, "Ma'am, I'm sure you're nice. I'm sure I like so and so." To hell with all that. Just He really is doing a good job asking questions. His voting record has been really good. He didn't vote for the omnibus bill. He didn't vote for the bill to keep the government running. He didn't do that. And now he's asking tough questions, dealing with all this stuff, dealing with the former Obama people. Anyway, we got one clip of John Kennedy the other day, and this is kind of going viral. People started to look at John Kennedy as a guy that's not scared to tackle tough questions and tough people.
Well, this was him questioning Sally Yates.
Yep.
Okay. I don't mean to wax too metaphysical here, but at what point does an act of Congress or an executive order become unconstitutional?
Well, it all depends on what the act does.
No, but I mean, at what point is it become? I can look at a statute and say, I think that's unconstitutional. Does that make it unconstitutional?
I think the issue that we faced at the Department of Justice is to defend this executive order would require lawyers to go in and argue that this has nothing to do with religion.
But at what point does a statute or an executive order become unconstitutional? Is it some a priori determination?
You should have saw a face.
I'm telling you what I'm getting at, and I don't mean any disrespect. Who appointed you to the United States Supreme Court?
Wow!
I was appointed.
That determined, isn't it a court of final jurisdiction decides what's constitutional and not? In fact, aren't most acts of Congress presumed to be constitutional?
They are presumed, but they're not always constitutional. And no, of course, I was not on the Supreme Court. And I can tell you, Senator, look, we really wrestled over this decision. I personally wrestled over this decision. And it was not one that I took lightly at all.
You did.
But it was because I took my responsibility seriously as acting Attorney General.
I believe you believe what you're saying.
Yes, I do.
I'm just trying to understand this is likely to come up in the future.
Well,
at what point does an executive order or statute become unconstitutional? When I think it's unconstitutional, or you think it's unconstitutional, or a court of final jurisdiction says it's unconstitutional?
I believe that it is the responsibility of the Attorney General. If the President asks him or her to do something that he or she believes is unlawful or unconstitutional, to say no. And that's what I did.
Okay, I get it. All right, let me ask you both a couple of questions.
All right, there it is. And Kennedy is, I'm telling you, he's become kind of a rock star. He's asking real questions. He's really, really being tough with these people. And of course, you had to see the face on the woman when she's like, it looks like in her mind that, who the hell are you? And what kind of questions are these? I've never had to answer tough questions like this before. John's just drilling down on them. And, they play games. And so it's amazing. It's amazing to watch. And I appreciate Kennedy. It seems like he took what he started doing here about 10 or 12 years ago, and he took it to Washington, D.C. Right, there's a lot of rumors out there. I hadn't talked to John about this. the one-term governor, Bill Edwards, trying to tax us to prosperity along with his co-governor, Jay Dorton. Speculation, John may come back and run for governor. Now, once again, some inner circles and people that I know, they think he's the perfect guy for the job. There's a flip side that says, John ran for Senate a few times, lost, but he won. Now he's going to come back and be governor. So I don't know that. I just, all this speculation, Jeff Landry's going to run, like the press is speculating. I don't see that. I think Jeff been doing a hell of a job as Attorney General and would probably like to stay there for right now. Somebody will come along to knock the liberal Edwards and Dorton off. Edwards will be gone, and Jay Dorton will live on $200,000 plus a year for the rest of his life on something he doesn't deserve. His ship came in because he knife bit her. And so now we're having to fight with this liberal governor and Dorton, who's probably, along with Angel, probably the most liberal Republicans I've ever seen in my life. And I've been calling this on Dorton for probably 15, 16 years. He's people in the press love him, and the people in the left love him, and the people in government love him. And the people that like big government, they love him. Why is that if he's such a big conservative? Just kind of curious. Why do they really love him? Those people hate Jindal. They hate Bobby Jindal. Boy, they love him some Jay Dorton. Love some liberals like Jay Dorton. And he got a Republican by his name, which makes it really, really nice. Bill Cassidy on Jimmy Kimmel. Just because he made the comment, he's got to pass. Jimmy Kimmel made some comments. A lot of people are upset about the comments he made. Kimmel, thank God he had insurance, could get stuff done. Wish everybody had insurance. That's fine. But, emergency situations, we've always taken care of poor people that can't afford it, people that don't have insurance. We always have. As a country, we always have. That's what Republicans in charge, too. Kennedy made the comment. He told Kimmel last night, you have to have health care program that only works for the patients but also works for the taxpayer. Well, Doc, don't forget, it's got to work for the doctor as well. And I think Kennedy, voting for the omnibus bill, trying to come up with which a lot of us deem a really socialistic health care plan. He's working with the lady from Maine, Susan something, I forget her last name.
Collins,
that's her. He's working with her, and you talk about a liberal. And you kind of wonder what Cassidy's doing. I mean, John, and Bill's got his people listening. Bill, I'm getting beat up for you. Y'all don't see my email with some of these people. People stay livid with me because Bill Cassidy's sitting there. And by the way, I'm not on Cassidy. I'll get on Cassidy. I've gotten on Cassidy before. John, Bill's going to have to run again. Bill's going to have to run on his record. Okay? If somebody comes along and proves to be more conservative, people are going to vote him out. And, when Jimmy Kimmel's for you, I get concerned for you. Kimmel said, obviously, Cassidy's someone who cares about people's health. Let me ask a question, folks. Who out there that you know of that doesn't care about people's health? White, black, Republican, Democrat, conservative, or left-wing global warming nut. Who doesn't care about somebody's health care? But I think everybody ought to have to pay in. Everybody ought to pay something. Why should somebody get something for free? That's the problem. You got people that get stuff for free, and you got another group now, because the middle class is tired, they get subsidies, and they think this is all cool. I ain't gotten subsidies. When does my subsidies kick in? Well, that's the problem. I'm not biting into that because I don't think I ought to have subsidies to kick in. I don't even know if how many people believe government ought to be in the healthcare system at all? I mean, they in it, and it's a debacle. They in it, and it's skyrocketing numbers at an alarming rate because they're in it. There was another article today, and I don't know if I can find it quick enough, but there was another article today on the skyrocketing premiums and what people are paying. Even subsidies, people with subsidies are starting to get out of hand. All because of Barack Obama and the Democrats who shoved this health care down our throat. They shoved it down our throat, and it's not working, and it's not going to work, and it can't work. And if the government, if we're going to spin it, and that's what I'm concerned about people like Cassidy, if they're going to spin it to tell us how great something is, and it's actually more government, or as much government, or the same amount of government, whatever, we're not going to ever win. Here, debt bubble landmine. Oh, by the way, don't forget the debt bubble landmine Obama left for Trump. Man, it's just unbelievable amount of debt that is a landmine for our economy. But Barack Obama was never charged or accused of anything, because the press never covered it. Where is the story? I had this story. I'll try to find it again. I mean, the premiums skyrocketing up and up and up and up. Press never covers it. Anyway, Bill sent it to Cassidy. I'm just telling you, there's a lot of people in this state getting very upset with the way you're voting. Remember, the voting record says it all. The voting record says who you are, nothing else. We've got to take a break. 844-766-6607. Hickson has a hotline. Take a break. Be right back. Hi, hello. Welcome back. Moon Griffon Show. Great to have you with us. 844-766-6607. Hickson has a hotline. Yeah, a lot of people have commented on Bill Cassidy, and I hadn't gotten one positive one yet. I just tell him when I'm getting stuff like that. And there's a few people on my butt. They want me to really go after Bill. It's not that I don't want to. I want to. I've disagreed with Bill. We fought before on the last time he did this, and voting for more spending. Bill's been there. What's going to happen? Sent it to Cassidy and say, okay, I voted for it this time, but I'm not going to vote that way in September or October. He never told us that. And Bill Cassidy is a physician. He knows a lot more about it than I do. I'm not going to say he doesn't, but the overall plan, which he says has to pass the Kimmel test, Jimmy Kimmel being, of course, a liberal, these people really think you can just have the best health care in the world and nobody has to pay for it. Nobody. These businesses are going to finally go, you know what? This benefit we've been giving out there, we just can't do it anymore. They're going to be better off giving a few $100s and tell people to go do it themselves. Obamacare premiums rise as insurers fret over law's shaky future. Folks, it's been skyrocketing before Trump came along. Cost up almost 20% in 3 states. They're starting to say, well, if they get rid of the mandate, prices are going to skyrocket more, like it's Trump's fault. This thing is skyrocketed out of hand already. Virginia, Maryland, Connecticut, first states to make filings public. Premiums Affordable Care Act plan will rise. This is for the people that are under Obamacare. Will rise more than 20% on the average. The increases following years of rising premiums under ex-President Barack Obama. Really? I'd have never thought it. Then they're trying to say, well, some of it is that we don't know what Trump's going to do. If he gets, Brant, to get rid of the mandates, young people are not going to buy insurance. So then he said it's going to get worse. You need to just get rid of the law, and this really doesn't need a big replacement. There's got to be a way through competition to get costs down. Buying across lines, medical savings accounts, all the things that make sense, the press and the left argue against. Folks, let me tell you something. I never said I was that bright. But if I go to work every day and I can go pay for an insurance premium, you can too. You just want something competitive. That's all. You just want something competitive. That's all we want. They're saying uncertainty equals higher premiums. And maybe that may be some truth to that, but the bottom line is we should never had this crap. And it is pure crap. I mean, for people in America to say this has been good for her is nuts. We got some states that don't have but one carrier now. We got some states that's going to have no carriers, nobody to sell insurance because of what they passed on Christmas Eve during the worst president we've ever had by far. It's just an incredible thing to continue to watch. I mean, unbelievable. 844-766-6607. Hickson has a hotline. The only thing I'll tell Senator Bill Cassidy is he needs to be very, very careful the way he votes. They better be very, very careful that some real conservative doesn't come along because people are not liking his voting record. That's just not. And what I'm talking about with Cassidy is his voting record. The voting record makes a difference. That's what makes the difference. All right, got an anonymous call. Let's go. Good morning.
Hey, Moon, how are you this morning?
Doing fine, sir.
Nice some news every morning. I appreciate your show. It's the only thing I can listen to and not get furious. Listen,
go ahead.
I'm semi-retired, trying to build a business over the years, and I'm one of those people that reports anywhere from 7 to 14 to 18, 15,000 a year income. You know, doing okay, but you know, that's in the poverty region. My Obamacare thing I was forced into went from $0 to $95 this year. Now, if you're a person that's not semi-retired and has something socked away, correct, and you're making $15,000 to $17,000 a year, that means those people now aren't getting free stuff anymore. They're charging them $100 a month for a $6,800 deductible. Now, maybe it has to do with my social demographic or age or whatnot. I don't know, but I was pretty shocked. The insurance company in Louisiana is telling me that if it wasn't for Obamacare, I'd be paying $1,034 a month for a $6,800 deductible policy. That is a lie. That's got to be a lie. That's outrageous.
Well,
so that's how bad.
Let me tell you something.
But no one's getting it free anymore. I'm not complaining. Don't get me wrong. but
what I'm saying is, they can tell you all they want to, because the way it was set up, $95 fine, and it's going to be this and that. They can say what they want to. The system that's currently in place is horrendous. Here's another thing. I hope you can get your insurance. I hope they got something good for you. But here's the bottom line. I've been working all my life. Okay, so all my life since I was probably 16 to 17 years old. I've been able to pay my health care bill. I've been able to pay my health care bill. Brian, I know we're getting ready to have to take a break. Been able to pay my health care bill. Obamacare came along and they pricing me out the market. I'm now more.
They did the same with me.
I'm worried about people that have always been able to pay their health care that can't. Nobody, including Bill Cassidy, Senator Cassidy, is talking about us. They only want to talk about poor people. You know, we know older people are already in the system. They want to talk about the poor, or somebody getting subsidies. What about the guys like me that have been able to always do it on my own? They don't talk about us. And there's a lot more us than there are them, but they're not talking about us, and that's a shame. Hey, I got to run. Thanks for the call. We'll be right back. Hi, y'all. Welcome back. Moon Griffon Show. Great to have you with us. 844-766-6607. Hickson has a hotline if you'd like to be part of the program. Your opportunity to be a voice. Somebody wrote, Moon, when my sons were growing up, infants, teens, doctor visit was $5. The average person did not have health insurance in those days. Then came Medicare. The cost of health care skyrocketed. It was the implementation of Medicare at the beginning of federal health care system. She said, I don't remember. Yeah, pretty much. Feds started getting involved. Where do they get the money from? They take it from people that are healthy. They take it from people who have jobs. This whole health care thing is tied around, especially when Obama came around, pure socialism. Everybody's the same. Everybody should make the same amount of money. Everybody should live on the same amount of money. Same size house. Only have one kid. Sound like we in China. 844-766-6607. Hickson has a hotline. Steve in Montgomery.
Yes, sir. How you doing? Fine. You're talking about Senator Cassidy. We shouldn't be too surprised. He supported, I believe, Songus, and I think it was Dukakis for president when he was a Democrat out in California. So I'm not surprised at all. I'm surprised I supported Rob Maness for his position. I did ultimately ended up voting for him. But I called him the other day. I talked to one of his aides, and I asked, what is the senator's position on the wall? They wouldn't give me an answer. Said he hadn't made up his mind. And, in Grant Parish here, the sheriff just confiscated $460,000 worth of crystal meth. And I asked the sheriff, where did it come from? Said it came straight from Mexico from the cartels. Mm-hmm. So, to me, if you want to stop the drug trade or at least slow it down, we need a wall. So, the senator, I guess, just doesn't understand that. And, I'm going to have trouble voting for him the next time.
Well, what'll happen is, I don't know what's going to happen. A lot of times what happens is if you're a sitting United States senator, it's hard to beat. Number two, they'll have the money coming from the rich and the famous. Number three, you'll have to have somebody with some money that can really show they're more conservative than he is, and I don't think it's going to be that hard when it's said and done. I want Bill. I'm telling Senator Cassidy, I think he has about 4 years, basically about 4 years before he runs again. The other thing he needs to remember, he runs next time, and I may be wrong on this, but I think I'm correct. He runs next time on the presidential ticket. In other words, there's going to be a presidential race going on when he's on. You have a lot of people going out. And I'm telling you, voting records should determine how people vote on a candidate more than anything. So he's got these voting records that are piling up against him. And when they came out with their HealthCare plan, people weren't happy about that either. They were going, "What in the world are you doing?"
I called his office another time, and it was actually about something out of state, about the Hammonds in Oregon who were rotting in jail for doing virtually nothing other than setting a backfire on the land. I think they burned an acre or two of the federal land, and they got fined $400,000. They given a 5-year jail sentence. One of them, the father was in his 70s, older than I am. I'm 71, so he was even older than I am. So it's almost a life sentence to put him in jail. And they put the son in jail, and I called to see if I could get some help for them. I don't know them. I just read about them. I thought it was awful. We got Hillary Clinton walking around who gave 20% of our uranium source supplies to the Russians. You know, she's walking around free, living in 2 mansions. These people are rotting in an 8x10 cell somewhere, and they're patriots. And I asked for help there, and they said they didn't have time to talk to me. So, you know, if you're going to stand up for liberty, I guess he doesn't want to, but I want my representatives in the Congress to do that. And you know, like I say, I'm gonna have trouble voting for him next time.
Well, like you said, but you didn't. But there's a lot of people that didn't support Cassidy the first time, but they came back around because I mean, for God's sakes, Mary Landrieu, come on. I mean, you know, Trump. But see, I think what happens with some of these elected officials is they get elected and they think everybody loves them. You know, like Bill Edwards got elected. I mean, he's a 44% at the most ever to get votes again, and they keep telling people that, boy, the way Bill Cassidy won, Democrats are the why. They're misreading elections. I knew people that ran when I was in Monroe, they would run for an office, and they would think because they ran against a bad person and they almost won, that now they can go duplicate it again, but they didn't realize the person they were running against was disliked as much as they were liked. And so you got voting records that come in this, and I just think Bill's on a slippery slope if he's not careful. A few more votes like this, and I think people are going to get upset. And guess what? They're coming. There's a wall vote coming. There's another budget vote coming in September. There's going to be a lot more votes coming. And I'm just saying those things are going to mount up. As a matter of fact, I looked at one of the conservative sites, and Bill wasn't highly rated.
No. I think actually, if it were his advantage to be a Democrat, I think he'd swap parties. But I don't know that, but that would be my guess.
Yeah, it's going to be interesting, Steve, see what happens with all this. But I know there's voting records pile up on people, and a senator has 6 years of voting records. So if somebody looks up and said, hey, I think I'm a real conservative, it's going to give him a tough time on the right. You know, by the way, we still have an open primary system now. And I don't know if that's going to change or not. But if it was to change, and you go back to a closed primary system like all other states, then he has a problem because somebody in the Republican Party might can beat him head up Republican against Republican. Yeah,
he might be toast if that happens. I don't imagine it will, but it could.
Yeah. All right, man. Well, appreciate the call.
Okay, thank you.
Let me get another one. Thanks for the call. 844-766-6607. Hickson has a hotline if you'd like to be part of the program. It's you know, Bill won. He was tickled to death and beat Mary Landrieu and all that stuff. But there was a percentage of people that didn't want to vote for him. And those people are still out there. Number two is, who knows if they'll go back to a closed primary? There's people trying to push closed primaries again. So, I mean, it's something to consider as these people run. Say, Moon, last year Obama calls, so email my wife and I $1,700 a month. They tried to charge me for not having health care for 5 months. Ever rebuked them and did not pay an extra $5,100 due to those erroneous supplemental money. I didn't receive this. This year I have Medicare and supplement, but my wife is still requiring a policy, which would, again, through the lousy marketplace. The premium for her alone, $11.75 a month with a $5,000 deductible. As of now, we're paying 100% of the doctor bills and medicine. Obamacare is killing us retired people. Obamacare was designed, Michael, to destroy the system so they could take it over. It was all designed. Let's go to Norman in Poachy Bridge. How you doing, Norman?
I'm doing pretty good, Moon. You're talking about Senator Cassidy.
Yeah.
Let me tell you something. He had a little town meeting in Brew Ridge the other day, when he was making the rounds. I went to hear what he had to say. A lot of people went over there to keep him from saying anything, and they were actually fairly successful. And, man, it was something else.
Well, when was that? Now, I remember him going to Brew Ridge a while back when they were trying to protest everything. Is that the one you're talking about?
Yeah, one of his more. In fact, I think I called you about it the day that it happened. Around the time he was on TV somewhere else where some raucous people were there. So, I don't know. I can understand the previous caller's frustration, but what are we going to do?
No.
Those people ain't going to vote for him. This guy ain't going to vote for him. We might as well get Landrew back in there.
No. I think if you heard the guy right out, Norman, the guy said he voted for Cassidy over Landrew. I mean, he just said he had no choice. So that's not going to happen. The Democrats not going to win unless Jay Darden and Scott Angel hanging around to knife the Republican. That's what happened in the other race. So I get a little concerned. But let me tell you something. Cassidy has a voting record he has to live with, not me, him.
Well, exactly.
He thinks voting from more government and big government health care is going to be the answer, then he may pay the price when the next election comes. I'm not downing him. I'm just telling you. My emails are lit up with people mad at him.
We're talking about what is, Moon. We're just talking about what is here, you know?
I agree.
So.
All right, man.
I don't know. Okay.
Appreciate the call. We've got to take a break. 844-766-6607. Hickson has a hotline if you want to be a voice. A lot of state stuff to cover. We hadn't forgot about it. By the way, you realize, Brandon, there's a big article how New Orleans is worse than Chicago when it comes to shooting. New Orleans. By the way, President Mitch Landrieu runs that city. We'll take a break. Be right back. Hello, welcome back. Moon Griffon Show. Great to have you with us. 844-766-6607. Hickson has a hotline if you'd like to be part of the program. It's your opportunity to be a voice. Hickson has a hotline always. Go back to the phone lines. Charles and Alexandria. How you doing, Charles?
Hey, Moon, fine. I'm missing something here. They keep talking about the cost of health care, and they immediately start talking about the premium cost. The cost of health care begins with the provider. Nobody's mentioning that. I'm 80 years old, and I got so many stories I could tell you, but I got some friends that don't have any money and no insurance.
Mm-hmm.
Their shots, same shots, cost $400.
Mm-hmm.
I have some friends that has really good insurance. That same shot costs $2,500.
Mm-hmm. Interesting.
And, I cannot understand why somebody hadn't mentioned the cost of health care. I mean, the cost of provider, and it can be controlled. They don't have to keep they don't have to fix the price. All they got to do is enforce the law that does now exist. You charge everybody the same thing for the same procedure of the same medicine. I mean,
you know why? But you know why they don't do that? I was talking to somebody actually last week and yesterday, and the reason they don't do that is because insurance companies, doctors, nobody. It's easy to say charge everybody the same thing, but it doesn't. It just doesn't work that way. I know to you and me, I agree with you, man. If a shot for me is $400 and the same shot, same medicine, everything the same is $2,500, then it's made to be determined by what your insurance is willing to pay. It may be determined by what kind of policy you've bought. I think this thing's got. Let me ask you a question, Charles. You're 80 years old, so you got a few years on me. This can't be that hard. This is created. It's created chaos for this to be this hard. It's no way it's this hard to deal with healthcare. It's no way.
On one sheet of paper, I could solve the problem. And I'm from Eckley, Louisiana, really, and don't have a lot of education, but it don't take a lot of smarts to fix this problem. I mean, those that those that absolutely can't pay, we need to subsidize them, and those that can need to pay. But if all they got to do, it's against the law. If I had a gas station and I sold gas for, I was in this. I used to do FEMA work, but anyway, if I charge more than the normal rate for a roof, man, they come down on me like it's against the law.
Yeah. I think you make a great point. The guy was also telling me, like, some hospitals charge a different rate for a different insurance company. Why is that? Why don't they charge the same rates? Why don't they charge the same rates? Every hospital charges the same rate, no matter if it's coming from Medicare, Medicaid, Blue Cross Blue Shield, or whoever else is out there.
But it don't matter. It don't matter what it is. If Trump would just do that one of them orders and say, I think it's a law, but they ignore that. Is you have to charge everyone for the same procedure, the same price. If you got a nurse that gives out an aspirin at 12 o'clock at night, if you charge the insurance company $25, then you charge the customer. That way, the competition gets back in, and that's why the insurance companies get to saying, well, what do you charge for this? Or I see your bill here. Mm-hmm. I'm not going to pay this $2,500. The average cost over it's just common sense. I was born word, if you beat the quality and the price, well, you win. Yeah. But it just blows my mind. I'm glad you listened to me because, and Abraham, if the only way I'm going to vote for him is if he's running against Mary Landon.
Well, no, nothing surprised me. Maybe Mary will make a week visit back. Anyway, got to run. Thanks for the call. Appreciate the call.
Boom.
Yes, sir.
Boom. Ask somebody else about that for me.
All right. Sound like a winner. Thanks. I think he makes a great point. Why does Brandon, me and you go get the same shots? It costs me $400, you $2,500. Does something seem wrong? And the next guy gets it for free. Brad Monroe. How you doing, Brad?
Hey, how you doing, Mr. Griffon?
I'm doing fine, sir. Good to hear from you.
I got a question, an issue. I don't know what to call it, but before Obamacare and before I got this job, when I got sick, I couldn't afford health insurance. Mm-hmm. I just went to the emergency room.
Yes,
so
sir.
You think it would be better for us to go back to that system where, hey, if people get sick, can't afford insurance, just go to the emergency room and let the taxpayer pay for it?
Okay, let me. I can answer that for you, Brad. And it's our problem in our state. I'm going to focus on the state. Our problem in our state is we had all these state hospitals, and what we should have went to, and some of the states have this, where we have we had at one time a state system, and we still do somewhat, some private stuff. We should have went to these clinics, and these clinics are cheaper. These clinics are more doable. You see them popping up all over the place now. Now, you still have to pay, but you go into these clinics. A lot of people go into the emergency room. Like if you're in a car accident, Brad, and really serious, you cannot be denied you cannot be denied at all if you get to the emergency room, at all. And you're going to be taken care of. Now, they may ship you to a state-run hospital after, but you're not going to be denied in an insurance. Emergency room. What happens in an emergency room is they're just very expensive. Very, very expensive. Look, we're always going to have poor people out there. We always have people that can't afford it. So I'm all for having a safety net for helping people who can't be helped. But there's cheaper ways to do it. The emergency room is just the most expensive way to do it.
Okay, then. So
you see what I'm saying? Like if you go to another state, they have these clinics set up. And people like yourself, if you didn't have insurance, or like me, if I didn't have insurance, we can go to these clinics. I'm running fever. My kid's running fever. I'll go to an emergency room. Let's go to a clinic. It could be something simple as a virus or something that you can beat, they can help you with, and get you out of there. I'm still for helping poor people. That's not what I'm saying. We got to have a place where we can help people who can't afford it. But the Obamacare itself was a total destruction of insurance. We're going broke. Insurance companies are pulling out left and right, and there's a reason for it. They can't make any money, and they're losing their butts off. It was a disaster. Obamacare was a disaster. If you're getting subsidies, that means I'm paying for your insurance. Why am I paying for somebody else's insurance? I'm trying to pay mine. You know, the president promised you can keep your doctor, you can keep your hospital, you can keep your plan. All that was a lie. I want you to realize what it was.
But if I go to the emergency room, you're still paying for me to get fixed.
No. If you go to the emergency room and you've been in a car accident or something serious like that, I mean, we're going to do that. But what's happening, you go ask people that have been involved in emergency rooms. They'll tell you they're seeing more people walking in just with fever, a headache, and all that stuff is very, very expensive.
Yeah.
What if you were going to a clinic that always had a doctor and a assistant or something like that, always on service, and you said, man, this headache's been on me. I'm running fever. My little girl's running fever. And you had a place you could pick up and go that could get you in and out, take care of you without running to an emergency room.
But when the clinic, you would have to pay, what, like $80 or $100 up front?
No, let me tell you something. It depends on how it's set up. Some of these are set up local clinics, and you may have to pay $5. Maybe $10.
Bad.
Well, I'm just saying other states have that. We just got a 1930s and 40s model that's never been corrected.
Oh. Well, because I'm a Democrat, and I'm for Obama, and my issue was I hear a lot of people, from what I was seeing in the news cycle, the reason these major insurance companies were pulling out of the marketplace because of the uncertainty, because Republicans saying they're going to dismantle Obamacare.
Brad, they've been pulling out since Obama started it. They all started running high, and then they started dropping and pulling out before Donald Trump's name was mentioned as president of the United States. That's a fact. Look, companies can't stay around losing $200 and $300 million a year. They're pulling out because the way it was set up with the mandates is crippling the medical this situation. And Obamacare has led to that directly. You can like it. You can like the president. I'm telling you, that is a disastrous plan that we got on us. If we just leave it alone and don't do nothing, you're going to see how bad it is. It's going to be horrendous, man. And it's already been horrendous. Hey, look, I'm paying unbelievable costs. I'm not on Obamacare, but when I pick my statement up because of the Affordable Care Act, because of the Affordable Care Act, because of the Affordable Care Act, I'm paying for birth control pills. You think I ought to be having to pay birth control pills? I don't think I'm going to get pregnant this year. Not because it's not because I ain't trying. I got to go, brother. Thanks. Appreciate the call. We just disagree. All right, be back. More of the Moon Griffon Show. Was that Sheila on the road? All that after this.